Hello and welcome to 72 Dragons. Today we had the pleasure of speaking with Dr. Jose Perez Ramos. He is a distinguished researcher and academic whose work in the field of public health has left a mark on the global landscape of healthcare and community well-being. His diverse range of research topics reflects a profound dedication to improving public health on both local and global scales. He is an assistant professor at the University of Rochester Medical Center School of Medicine and Dentistry. He has experience in different roles, such as assistant professor in the Department of Public Health Science, the Department of Pediatrics, the Center for Community Health and Prevention, and the Department of Obstetrics and Gynecology. This reflects a commitment to advancing public health from various angles. Welcome to this interview, Dr. Jose Perez Ramos. It is an honor and a pleasure to have you with us today. My name is Dr. Pietro Aparicio from 72 Dragons. Thank you for joining us and for sharing your experience with us. Without any further ado, let's begin. Can you tell us more about your academic and professional background leading up to your current role? What inspired you to pursue a PhD in translational biomedical after your master in public health?
Yes, first of all, good morning, and thank you for the opportunity. So I'm a first generation college graduate. So I did not have necessarily an idea of what college could be, but I always knew that that I want to pursue bigger things, right? That I want to help my community. I'm from Puerto Rico, and I wanted to always. I had the idea of what a community could be and what a community should be, and what were the things that were lacking in my community, right? And I started my career thinking in politics. So I did my undergrad at the University of Puerto Rico in political science, thinking that I might actually going to pursue that route. However, at some point in my career, when we moved to the United States, I was a little bit lost, and that happens with a lot of us, right? That we're trying to find our north, right? And I found public health as a way to use my passion in politics or political science and health, and how we can merge them as part of a community to help the community, right? So then from that end, moved to translational biomedical science. What I found is I see translational science as an opportunity to see things from, let's say, the forest canopies of trees, right? You're going from 0 to 100. You're going from a cell to the vaccine. You're going from a challenge in the community and how we can use technology to address it, right? And that's why I was very interested in translational biomedical science, focusing in technology, right? And how can we use technology to advance health equity?
Great, thank you for sharing. Now that you mentioned technology, the use of technology and mobile solutions seems to be a recurrent theme in some of your research. How do you see the role of technology evolving in the field of public health, and what potential does it hold for addressing global health challenges?
Yes, thank you for that question. Before I answer it profoundly, I have to acknowledge, and we should acknowledge, digital divide. Digital divide is a thing, right? It is real, meaning that not everybody have access to technology the same way that all of us, or like some of them has, right? And the idea is equity needs to be addressed, digital divide, in order to use technology in an equitable way, right? Having said that, I see technology as a tool to address or to advance health equity. For example, we're seeing a lot of movement lately into AI, artificial intelligence, right? It's not just for the sake of looking for an answer using AI. How can we use that technology, super powerful technology, into help addressing some of the health challenges that we experience in a lot of communities? For example, we can use it to increase health literacy for people with chronic diseases. How can we address that using technology, right? The idea is something as simple as your phone that you carried, those communities that have access, again, right? We can use it not just for the sake of looking at the news or looking at social media. Let's just build it in a way that it's a tool that you can use to advance into maybe learning more about your health condition.
Talking about health equity, and could you provide some insights into the research collaborations and findings with Dr. Nancy Cardona Cordero and Cynthia LeBron? What are the key aspects of the Hispanic paradox that your work is focused on debunking?
Yeah, this is maybe a trivial question and answer. I think there is an old and a new way of seeing Hispanics in the United States related to health, right? And I know there has been a lot of work previously related to or identifying the Hispanic paradox, right? There's a lot of epidemiological studies published. There's leaders in the Hispanic health community. They're back in then. I mean, they analyzed the data, right, from a conglomerate aspect, right? Like it was what was known, right? Now we're looking at more in depth into the data. Although we're Latinos, as you know, we're not equal. We're not the same. Like we carry different genes, right? We carry different social determinants of health, right? And those are factors that we're seeing a lot into the differences related to health outcomes on Latinos.
That's a very interesting point and a big question for the Hispanic community. Now, the American Public Health Association annual meeting is coming up in Atlanta, Georgia, and you are attending particularly to celebrate the 50 years anniversary of the Latino Caucus. Can you tell us what motivated you to join the American Public Health Association and particularly the Latino Caucus?
At the association, the American Public Health Association, that represent us, and I think representation matters. We see an amalgam of different groups of Latinos providing really amazing work in the advance of public health, and for me, it's an opportunity to learn about what others are doing to advance in terms of even health equity, right? A representation, a voice for us, and also connect with other colleagues that I might actually even know that the work they're doing, their amazing work they're doing, and see how can we collaborate. I'll tell you a story, very simple story. Last year, I met Dr. Cynthia LeBron. It was the first time that I met her, and from that, we went into writing a paper. So you see how collaborations can be happening in this type of events where we have common interest and then collaborations start to come out. So I think it's very important for us to keep growing in these communities.
Great. Thank you, and congratulations to the Latino Caucus for the 50th years anniversary.
Indeed.
So we have been talking about disparities. So what impact do you hope your research will have on healthcare disparities in underserved communities? And what advice would you give to aspiring researchers and public health professionals looking to make a difference in their communities?
Yes, there was a pivotal moment, and I talk about this with other colleagues. There's a pivotal moment in my career when, after I finished my PhD, I went back to the community to provide some of the insights or some of the findings of my work, right? And I remember sitting down in the town hall meeting, because that's the way that we decided to present the findings. And I remember sitting down there presenting, and people were very excited about it. However, I remember a person that said to me, "This is great. However, what we need is health access." Keep in mind, my research was in environmental health risk. That was like the one that I was presenting. And it was using the mobile app, right? Then at that moment, I had to make a decision of either listening to the community or going through my idea of keep pursuing this idea of mobile apps in environmental health. It was hard because I already had in plan all the things that I wanted to do. So that pivotal moment taught me that I had to listen to the community.
Thank you. Put the community first, listen to the community. Dr. Jose Perez Ramos, thank you for your valuable insights and the difference you make in the world of public health. Your dedication to improving the lives of individuals and communities is very inspiring. Thank you for sharing with us today.
No, thank you for the invitation. And I'm looking forward to see you in Atlanta.
Wonderful. Yeah, I'll be there. Thank you.
Thank you.